Good evening, everyone. Thank you so much for joining us tonight for a special pre-election day webinar on California's Proposition 14, the Californians for Stem Cell Research, Treatments, and Cures Initiative of 2020. My name's Audra Hines, Vice President of Care Services for the ALS Association Golden West Chapter. To kick off tonight's call, I'd like to introduce the Golden West Chapter's President and CEO, Fred Fisher.
Hi, everyone. Thanks so much for joining us. The Golden West Chapter is really pleased to be able to offer this important opportunity to learn about Prop 14 and learn about the impact of stem cell research in California, and particularly the impact of that research for everyone living with ALS. The chapter's role in advancing public policy is something we take very seriously, and we're so proud to be early endorsers of Prop 14. It's my pleasure to introduce our two speakers. You're privileged tonight to hear from really world leaders in advancing the search for treatments and cures, and in particular ALS. And so it's terrific that you're all here. I'm so grateful that they're here, and I'm sure by the end of this you will come away understanding more about stem cell research, more about the importance of stem cell research in terms of the process of discovering treatments and cures for neurodegenerative diseases, including ALS, and you'll come away understanding a lot more about the importance of Prop 14 to the future of that research. So let me not take any more time and get straight to our first presenter, who is Bob Klein. Bob is a patient advocate through and through. His public service and charitable commitments are focused on medical research. His commitment in this area really started with his younger son Jordan's diagnosis with type 1 diabetes in 2001. In addition, his mother was diagnosed with Alzheimer's 2 years earlier. Bob is the chairman of California Stem Cell Research, Treatment, and Cures Initiative of 2020 and the author of Prop 14. He's also the chairman of the California Stem Cell Initiative in 2004 and authored Prop 71. The Golden West Chapter was an early adopter and an endorser of Prop 71 as well. Prop 71 passed and gave rise to the California Institute of Regenerative Medicine, affectionately known as CIRM. He's the chairman emeritus of CIRM and is the chairman and president of Klein Financial Corporation. He's received numerous awards for his public service, including Time Magazine's one of the world's 100 most influential people of the year, and Scientific American's one of Scientific American's 50, where he was dubbed as a leader shaping the future of science. And I'm very proud to announce that Bob, later this year in November, will receive the Golden West Chapter's Dean and Kathleen Rasmussen Advocate of the Year in recognition of all of his work. So please join me in welcoming Bob Klein.
Thank you very much, Fred. It's a great privilege to join you tonight. It has been an extraordinary journey with the ALS Association from 2004 through 2020. It's been a journey of basic science discovery and, as Clive Svendsen will discuss, of concepts and discoveries moving into the clinic with his clinical trial and the Brainstorm clinical trial, a whole new chapter on potential advancements for ALS has become a reality. Both of those clinical trials funded through Proposition 71. As background, as Fred has said, I came into the area of medical research funding through my youngest son being diagnosed with type 1 as a type 1 diabetic. And it was an extraordinary revelation to have a young child that went from being considered healthy on one day to having a chronic disease the next. The same kind of transition, I suppose, that occurs when you have the transition to understanding that your son or daughter or your spouse may have ALS. I've been involved with members of the ALS Association, including Diane Winokur. If we could put up that slide. If we'll go one. Well, before I leave this slide, just so you understand the breadth of the work of Proposition 71, which will be carried on by Proposition 14. The young man on the left was a quadriplegic, and he went to USC Hospital, was patient number 1 in a clinical trial for total paralysis. His parents had been spoon feeding him to keep him alive. This is a picture of him about 6 months after a single infusion of 10 million stem cells into his spine at the point of injury. Lisa Wittenberg is in the center picture, an ALS patient, and the Evangelina Vaccaro was a bubble baby born without an immune system. Don Cohn at UCLA, with a grant from Proposition 71, created a whole treatment regimen that has now returned 70 children to complete health with restored new immune systems functioning fully in the society. But focusing on ALS, if you could go to the next slide. Obviously, this is a picture of me with Diane Winokur, who's lost 2 sons. It's a cute video, but I think for time purposes, I might skip the video. But this is, I was working with Diane on the Ice Bucket Challenge, and my plaudits to the brilliant genius at ALS who created the Ice Bucket Challenge. Diane got the honors of dumping the ice bucket on me that day, but it was a wake-up experience. But I've been working with Diane for years. She has been a member of the governing board of the agency as a patient advocate representing ALS for a decade, and is a brilliant advocate for ALS, with a tremendous story, of course, of losing the 2 sons. In terms of understanding where we have come and the breadth of what we have done, and given that Clive is going to give you an in-depth view of the clinical trials for ALS and the advancements of stem cell research for ALS, if we could go to the next slide. Hi, I'm Bob Klein. The new proposition authorizes $5.5 billion to continue this research, and $1.5 billion of it is reserved for brain-related diseases, including areas that deal with the spinal cord and the central nervous system. The reason that 1.5 has been set aside is that this is such a complicated area that we didn't want all the funds to go off into diabetes and heart disease or cancer, areas that could move faster. So I specifically reserved a major portion of the funds to deal with an area that involves ALS, as well as Parkinson's, for example, the Michael J. Fox Foundation being another endorser of this initiative. Can we go to the next slide? We're going to go through this. This is going to start this in a second. This is a video. And just to show you, this is the condition, the same condition of the young man we showed you earlier lifting weights. Jake Javier was fully paralyzed in a diving accident. And in his own words, he's going to quickly describe in what is really an ad in the Prop 14 campaign, how he has benefited from the research funding that led to the clinical trial that has restored substantial upper body function. Can you go ahead and play it?
A fluke diving accident the day before my high school graduation left me completely paralyzed, but a stem cell treatment helped me move my arms again. Prop 14 will continue to help millions of people who have serious injuries and diseases. Please vote yes on 14. Thank you.
Okay, if we could go to the next slide. So this young woman failed every possible therapy for cancer and is now a cancer survivor because of a therapy funded through discovery and later clinical trials for a form of blood cancer that had no treatments that were successful. She has been now several years, as she will describe, free of cancer in full remission through the Stem Cell Institute research. Go ahead and play that.
At age 28, I was diagnosed with an incurable form of blood cancer. I was losing hope, but signed up for a new treatment developed with California's Stem Cell Institute. It saved my life. Now, years later, my cancer is still in remission. Prop 14 will continue funding to find treatments and cures for diseases like cancer, diabetes, and Alzheimer's. Please vote yes on 14. It could save your life or the life of someone you love.
So if I could go back to the next slide. Let's go forth. This is Seth Rogen. Many of you may know, very popular in Southern California. We can go forward.
Losing a loved one to Alzheimer's is devastating. Prop 14 will continue groundbreaking stem cell research and dedicate funds specifically to finding treatments and cures for brain diseases like Alzheimer's.
Please join us and vote yes on 14. Thank you.
Okay, and go ahead to the next slide. All right, so before going through this slide, what I'd like to do is basically make sure that everyone understands that when this proposition that's on the ballot is directed to funding stem cell research and related genetic research and therapy development and clinical trials for chronic disease and injury. And it's the mechanism for the $5.5 billion is to authorize through Prop 14, $5.5 billion in bonds. And those bonds are sold over about a 14-year period as the research and clinical trials are approved and they hit the milestones and qualify for funding. So one has to ask, in what context are we asking for this approval? And the context for California is that it cost, according to a completely independent group, the Partnership to Fight Chronic Disease, which is 100 key medical societies and patient advocacy groups, $4.7 trillion for California between 2016 and 2030. That's about $300 billion a year. So we're funding $5.5 billion, to put it in perspective, over about 14 years, just short of the same period. What we're looking for is the tipping point to create the breakthroughs and the models to get them from discovery through therapy development, through preclinical work, into phase 1 trials to show there's no toxicity, into phase 2 trials to show proof of concept, and then hopefully partner with biotech to fund the big dollars to carry it through phase 3 and to get to patients. Where are we in doing this? Well, we have 94 clinical trials that have occurred under Prop 71, and we have 3,000 peer-reviewed published medical discoveries. Now, if you take the period from 2007 through 2019, just the end of last year, and you average that out, that means on 7 out of every 10 days after we started funding, there was a peer-reviewed published medical discovery, an astounding level of productivity in moving medical research and therapy development and clinical trials forward. The results of that include 2 cancer therapies. One of the patients that is a survivor because of one of those cancer therapies you just saw a short video with. And in addition to the cancer therapies that have reached final FDA approval, we have 9 breakthrough designations from the FDA and or what's called RMAT, or Vital Research Accelerated designation for very important breakthroughs that are in phase 2, ending phase 2, or in phase 3 clinical trials that are all FDA approved. So we have tremendous progress here towards therapies for patients. And Clive's trial that he's going to explain to you is certainly one of the very important trials that we're looking to for progress. But when you're considering a question that came in before we began this afternoon, can we afford the cost of Proposition 71? You need to understand it's in the context of $4.7 trillion in medical costs for the state, for families. Chronic care is the leading cost of bankruptcy. Under Prop 14, not only will we fund the therapy developments and the discovery, therapy development, and clinical trials, but I created an access and affordability working group that is specially staffed with a staff of 15 and an expert panel that will work to get early insurance adoption for these therapies. And to the extent that individuals can't afford to go through clinical trials because they need a caregiver to go with them, they need to travel a distance, it will have money for travel costs, for lodging, and for meals, so that people really get access. If they live in Fresno and have to go to UCLA or Cedars, they will have the money to actually get to the trial. The trial itself won't cost the money, but they need money to get there. So that's a new feature that's been covered in addition to the research. Another important point that it was asked in one of the questions that came in early was, is Proposition 14 necessary? Because you have all these discoveries. Can I go to the next slide here? If you look at the next slide, you will find that in the Los Angeles community, as an example, including all the way down to UC Irvine, if you look at UCLA, USC, City of Hope, Cedars, Children's Hospital LA, you find on average about 50% of all government funding for research, therapy development, clinical trials is from the state. So if you cut out this program, these institutions are crippled at best. And the alpha clinics, which are the great academic centers like Cedars, like USC, like UCLA or City of Hope, that have medical research capacity and hospitals, who have alpha clinics specially staffed to advance stem cell trials, all of that structure and framework goes away. You have 12 institutes. You have 12 institutes, centers of excellence, and specialty research centers in the state. You have the alpha clinics. You have a complete infrastructure for quickly advancing new therapies that dissolves because you lose half of all the funding in the state for stem cell research and therapy development and clinical trials. And if it happens to be a pluripotent stem cell type, like embryonic stem cells, there is no federal funding at all because of religious pressure. And there is no funding for fetal stem cell therapies either. So California is the only game in town. It is not only necessary, it is critical. California is ranked number 2 in the nation, number 2 in the world as a nation, with number 1 being the United States for biomedical research capacity. And we're the only place in the United States with the funding capacity for the full breadth of stem cell research and clinical trials. If this doesn't pass, that goes away. Another question that came in was, is it fatally flawed because it doesn't have equity participation for the state through a venture capital model? And our mission is to advance research and develop therapies. Royalties and licensing revenue are a side feature. They're less than 10% of the return to the state. The real return to the state is returning the citizens to health. The real return is breakthrough therapies. The real return to the state is changing the future healthcare cost in the state and restoring health to California's families. So we got to understand the mission. It would have taken a constitutional amendment to get into changing it and making California kind of a venture capital participant. That's not what we're about. We're about therapies for patients. It is also really important to understand that the question is, can we afford it, goes to the question of how this was structured. It's structured so there's no payment on the bonds that finance this until 2026, 6 years out. So there's no stress on the state's economy while it's recovering from the COVID recession. In fact, it's projected to create 100,000 new jobs with enough revenue generated from those jobs that it will cover bond payments for at least the first 12 years. So we get a stimulus program with 100,000 jobs that is focused on reducing human suffering, restoring health to patients, and potentially curing these chronic diseases in addition to mitigating the disease. And it is part of our recovery plan at the same time. We can afford it. We must afford it. Our duty is first to patients, and hopefully it is unstoppable. But if it is, it's only because we have this 90 patient advocate organizations and medical societies like ALS, which is one of the leaders in the Golden West chapter, led by Fred and this executive staff, that has really helped send the information out to all of its members, and those members have recruited their friends and families and educated them on how critical this is. The slide that just came up is an important one, because in looking at the $4.7 trillion in cost, at the bottom line, the biggest savings to the state, which is the real payback on this $5.5 billion, is in the slide that just came up. We can save, according to this independent group's projection, principally in reducing those costs to the state from new therapy innovations. And those therapy innovations, if they projected, could save up to $60 billion a year, or $900 billion over the period of 15 years. It's in this middle box. It says $60.4 billion saved a year from potential alternative mixes of different treatment advances. So we're an important contributor to the key program to help California save $60 billion a year. Certainly only a portion from the stem cell therapies, but an important contributor, and a contributor that reduces potentially, as part of a master strategy, up to 1.1 trillion of that 4.7 trillion cost. Again, this is the byproduct we hope will come out of this research, but the main product, the main goal is develop the therapies, mitigate disease, restore health. So thank you very much.
Thank you, Bob. I think it's just amazing that through Prop 71 and now through Prop 14, you have really worked to change the landscape for science, and you've positioned California as a global leader in advancing the search for treatments and cures. And I know on behalf of the entire ALS community, we want to thank you for the great work and for attracting world-renowned experts to California to advance therapeutic development, and doing it in ways that are such important economic boosts and really repositioning California as a global leader in the search for treatments and cures. So thank you very much.
It's a privilege. Thank you.
Our next presenter is an example of exactly that. A world-renowned researcher who came to California and is intricately involved in the search for treatments and cures for neurodegenerative diseases. With us tonight is Dr. Clive Svendsen. He did his pre-doctoral training at Harvard University. He received his PhD from Cambridge University in England, where he then established a stem cell research group before moving to the University of Wisconsin in 2000 to become professor of neurology and anatomy and director of an NIH-funded stem cell training program and co-director of the University of Wisconsin Stem Cell and Regenerative Medicine Center. In 2010, he moved to Los Angeles to establish and direct Cedars-Sinai's Regenerative Medicine Institute, which currently has 15 faculty members and approximately 100 staff. One focus of his current research is to create cells from people with specific disorders, which can then be reprogrammed to a primitive state and use those cells as powerful models of human disease, otherwise known as disease in a dish. Dr. Svendsen has led the first groups to successfully model both spinal muscular atrophy and more recently Huntington's disease using this technology. The other side of his research involves cutting-edge clinical trials. He was involved with one of the first growth factor treatments for Parkinson's disease and is currently working closely with neurosurgeons, neurologists, and other scientists to develop novel ways of using stem cells modified to release powerful growth factors to treat patients with neurological diseases such as ALS, Huntington's, Alzheimer's, and Parkinson's. Dr. Svendsen, thanks so much for being with us here tonight.
Great, thanks so much, Fred. Just doing a sound check. Can you guys hear me fine?
We can hear you.
Great. All right. Well, very nice to be able to tell you some of the work we're doing, and it's great to be have Bob discuss the CERN funding that has really been integral to everything I'm going to tell you about today. This is where I live most of the time, Cedars-Sinai Hospital. We're in the heart of LA, and we're really obviously a primary community hospital, but we're also a research hospital and training hospital for physicians. So we do everything from bench to bedside, we call it, which means if we have an idea in the lab, we can take it all the way from the laboratory into patients. And I think this is going to be an example I'm going to show you now of how that works. And CERN is important. And I'm going to tell you how important CERN has been for us at the hospital and moving this research forward. And I think it's important for a number of reasons. The first one is the options for patients are amazing if you just look on the internet for stem cells. But as we know, many of these companies that advertise stem cell therapies are basically bogus, and they pop up and down. It's like the whack-a-mole game. I think the FDA pushes one down and another one pops up somewhere else, and they feed off people's interest in stem cells because it has a resonance, that word, that's very powerful. And what CERN did is took that powerful resonance and turned it into reality, rather than these companies that claim to cure everything with a stem cell such as this one, which disappeared and then popped back up again as this one. And we need CERN, and we need these hospitals to be doing defined stem cell research so that we can really move the field forward for patients. I'm really going to focus on two trials today and two ways of treating ALS with stem cells that have been part and integral to CERN. The first one involves these stem cells. Now, when you hear the word stem cells, it's a little like ice cream. You get different flavors of stem cells. It's not just one. So the word stem cells is not ubiquitous for every type of stem cell. It's in fact broken up into different types of stem cells. The first one is the blood and what we call mesenchymal stem cell, or MSC. Now, these come directly from the bone marrow. You can do them with an aspiration where you put a needle into the bone marrow and draw it out. And within the bone marrow, deep within the bone marrow, are these mesenchymal stem cells. And these mesenchymal stem cells are the green ones here. And at the same time, when you pull these out into the petri dish from the bone marrow, they can divide and grow, and they form a layer of cells, and you can actually multiply them to millions and millions of cells that are known as bone marrow stem cells. The second cell, obviously in the blood, is what we call the hemopoietic stem cell. This is the cell that gives rise to all of your blood cells in the body. So these cells can be used as stem cells in therapy, and Dr. Stan Appel has pioneered the use of blood stem cells in patients with ALS. And there have been some interesting results with this method of stem cell treatment. In fact, Dr. Appel has a new program in stem cell research using T cells. These are white blood cells to modify the inflammation that you see in ALS, and is moving that stem cell treatment forward in parallel with the two that I'll tell you now. That's another exciting area that is coming forward in ALS, and that's to modify this inflammation that we see in the disease. Dr. Appel is down in Houston. The other type of stem cell I mentioned is a mesenchymal, and really this is being pioneered here with CERN funding by the company Brainstorm down here, who many of you probably heard of. And in fact, Brainstorm takes these mesenchymal bone marrow stem cells, divides them, puts them in the petri dish and grows them up, and then injects them into the spinal fluid of the patient. And this trial is a phase 3 trial now. It's been going for almost 8 to 9 years. It's fully funded by CERN. And the product is called Neurone. And these cells live in the spinal cord, in the middle of the brain, and down into the spinal cord in the CSF. It's called cerebral spinal fluid. And the cells actually suck out bad things from the spinal cord and release good things into the spinal cord. They're kind of like cleansing it for the patient. It's the concept. And now we have to look and see if that really affects the progression of the disease. And this is the critical trial. It's going to be opening up in November. That means you'll find out the data from this trial in November. They've fully recruited, as far as I know. And Ralph Kearns will be talking about this shortly. And we're very excited to see if these types of mesenchymal cells can slow down progression in ALS. Now, neither of these studies replace neurons or astrocytes, and these are the cells I'm going to talk about. They really are anti-inflammatory. They're like a treatment to slow down the disease progression by using these stem cells to reduce inflammation, the bad things that go on in the brain. And they also may release growth factors, and I'm going to mention that in a minute, that modulate the brain or maybe protect it. But they're in the middle of the CSF, and they're a little diluted as to how far deep into the brain tissue they can go. And as I mentioned, we're waiting for these results from the company Brainstorm to see if this approach of putting these mesenchymal or bone marrow stem cells into the CSF can slow progression in ALS. And that's a very exciting area, and we're really hopeful that something will come from that. The area that I've been involved mainly with is this third type of cells called a neural stem cell. And this is where Bob Klein mentioned it's been historically important to have the access to be able to use embryos, human embryos or fetal tissue, to obtain these embryonic stem cells. And these embryonic stem cells come from fertilized embryos. You then grow them out, And they can make these neural progenitor cells, which are the precursors to the cells within the ALS patient, within the brain and the spinal cord. And of course, we can think about in the brain replacing neurons that are lost. And in fact, this is maybe possible in the future, that you can, when you move your body, your neurons are in your spinal cord connected to the muscle. And it's those motor neurons that actually are lost in ALS, and that's why you become paralyzed. So it may be possible to put these new motor neurons back in to replace the ones that are lost. Now, the problem is, there's a very long connection from my spinal cord to my arm, and to get the axon, the fiber, the nerves to grow back is very difficult. There's also another type of cell that they wrap around the axons, called oligodendrocytes, a horrible name, but it's a myelinating cell. And that's a cell that might be used eventually in multiple sclerosis. That's a cell that dies of multiple sclerosis. There's a third type of cell that we've been very interested in, which is the astrocyte. The astrocyte is like the support cell for your motor neurons that are producing movement. So your motor neurons fire a signal to make your muscle move, but all around your motor neurons are protective cells called astrocytes. And these astrocytes are very important for protecting, and we think would be very useful to put new ones in, because they may go wrong in ALS, and there's evidence for that. So in the future, we might be actually doing motor neuron replacement and the work of CERM, and looking at these embryonic stem cells and other types of cells to make new motor neurons in patients might be very important. That's future research that we're doing and many labs are doing. It's very exciting. But right now, we actually have the potential to use astrocytes to try and use this for ALS. And there are risks involved with this, with the stem cells, which is why it takes a lot of time to do these trials and a lot of funding. So the trial I'm going to mention now is the one that CERM funded. This was a large grant from CERM. I'd like to point out that I did come to California because of CERM in part. I also came because my wife's from Los Angeles, and we're interested in moving from Wisconsin, where the temperature was a little cooler. But the combination of CERM and Cedars-Sinai and the wonderful work that Bob Klein did to lay the groundwork to have this funding attracted me and many other people to California to do this kind of work. And I honestly would not have had this funding in Wisconsin to be able to do it at the scale I needed to do it at, and the team that I developed needed to do it at. So we're very excited to have the funding, and the system that Bob Klein and CERM set up made it very conducive to applying for this funding through the state of California. So this is the trial I'm going to mention. I'd like to point out the clinical PIs, Bob Balo, Pablo Avalos did a lot of the work with the cells and helping the neurosurgeon, Pat Johnson, do this trial in patients. And just to show you, it's a village. It's not the whole team, but almost all of the team that were involved in this trial. And somehow my daughter and my wife was very involved with the trial. She read all of the IND and was involved, but my daughter slipped in here as well to the dinner that we had celebrating the trial completion. What do we do? Well, here's what I told you. Here's the neuron, the motor neuron in the spinal cord. It's a cartoon. And the motor neuron, as I said, attaches to the muscle. And here's the astrocyte that's protecting the motor neuron in a healthy individual. And in fact, this astrocyte has effects. It protects the blood as well from the brain leaking in. So these astrocytes are incredibly important. And if they go wrong in ALS, as Don Cleveland and many others have shown, these astrocytes basically go wrong. And now the motor neuron can't function. As you see, it's pulling away from the muscle. And if this connection isn't apt to the muscle will not function or move. So we need a way of treating that. And this is the transplant that we do. We put in a cell that now makes a new astrocyte and replaces the astrocyte that's lost in ALS. And this transition, as you go back one slide, you'll see the transition from being disconnected. And when you put the cell in, now we protect it so it doesn't disconnect anymore. It rejoins with the muscle is the crucial part of this trial. And we did find through a lot of work that if we could release a growth factor, these cells were engineered to release this growth factor, GDNF, the effect was even more powerful and sustained, and these motor neurons could live for much longer in all of the animal models that we used. This led to the CERM trial. I'm not going to go through any details today. I'm just going to give you a very high-level summary, and then I'll finish. The trial, as you can see, was started back in the ideas and concepts through the first grant that we got from CERM, where we had to make the cells that we were going to put into patients. This required a lot of interaction with the FDA and a lot of growing the cells and expanding them and then putting them into tubes. We then had to do animal studies to show the cells were safe and they didn't form tumors. And then we received a second grant once we got this IND. This is an investigational new drug, and CIRM-supported studies got us to this point. We then applied for a second trial, a second grant from CIRM in order to do the actual trial. Just to let you know, this is an enormous amount of work, and only something like a CIRM grant could fund it. These are 4 copies of the application. It's over 4,500 pages long. And this is the kind of work that we have to do to get these trials submitted and approved by the FDA. So this was approved by the federal government. We weren't doing it as a shady clinical trial in another country. This was done in USA with FDA approval through CIRM funding. And this is the critical part of CIRM, is it allows us to do these trials properly. We got approval in 2016. The trial itself, this is a long slide with a lot of words. It basically just tells you the protocol. This is the heart of the trial. And we called it a 1-2A. This means it's a safety study. The first thing the FDA said was, show us that you put these cells, and we had to inject these cells directly into the spinal cord. So we need to have a neurosurgeon inject them into the spinal cord of the patient. Show they're safe. And furthermore, go into the leg region of the spinal cord. And this is the lumbar region. So that if they go wrong or something happens, they don't cause too many problems. And the worst thing that could happen is you'd lose some leg function, but your arms will remain okay, because all of the cells that move your arms are higher up in the spinal cord and connected to your brain. So they made us go low into the lumbar region. So it was a safety trial to show the cells could get into the brain and survive. And we also did this interesting trial where we could put the cells on one side of the spinal cord and see if they affected one leg versus the other side and the other leg. So it was a very interesting design. And again, safety was our primary outcome. And that means, what were we trying to test? Testing they're safe. And if it's safe, we then go to the second phase, which is a phase 2 proper, which is more patients. Secondary, we obviously looked at function over time in these patients as well. So this was the last patient that was dosed. They had the surgery with Pat Johnson in October of 2018. And then we had to wait a year after the last patient till October 19 in order for that patient to get through the end of the protocol. And then we had to wait another amount of time for a lot of data analysis and closing the trial down. And so we did the injections. Just to summarize the results, and then I'll complete this part. We did get 18 patients enrolled in the stem cell trial. The device that we used to deliver the cells was easy, simple, and the patients undergo the surgery, and they all recovered fast and were out of the hospital within 3 days. This is a one and done. Once you have the cells implanted, there's no more treatment, except you have to take immune suppression, because we're worried the cells may reject, although now we're thinking that only needs to be for a period of about 6 months to stop the cells rejecting, and then they settle in and they'll survive for a long period. We didn't see any adverse effects, a little pain, which after the surgery, which then subsided and was treated easily. And so the study should or will meet the primary outcome of safety. Every patient who came to postmortem who died also donated their spinal cord, and we're very happy to report that there were cells releasing the GDNF in every single patient. And so this is very encouraging for the field, because it shows that these cells can survive in the spinal cord of patients. And so this is a very important piece of data for us to move to the phase 2. If we'd not been for COVID, I would be telling you all the results now. We were ready to go in February, and then the committee that has to come and look at our data could not visit from Boston, and so we're still stuck in COVID delays. They're now visiting as we speak, and we should be able to release all of the data very soon for this trial. But we do know it's safe. We do know the cells survived, and we've looked preliminary at some of the function, and we're just validating that the functional effects were in fact validated after we test all of the information that came out of the trial, and that'll be released very, very soon. We are moving forward. We're going to do another 3 lumbar patients. The first ones were quite progressed. They were late in the disease. We're now going, because of our safety trial, earlier in disease progression. We know now we have to go a little deeper. We went a little higher because we were worried about going too deep in the first patients, but we now know we can. So we're going to go a little lower as well in these patients and look at very specific outcome measures. So we think the combination of these 3 will increase the power of the study significantly. So in the last few minutes, I do want to move to what I think is a very exciting area that has come from our initial CIRM funding, allowed us to get the safety data and convince the FDA and the scientific community that these cells will survive in ALS. Of course, ALS, as many of you know, actually affects not just the spinal cord down here, but affects the motor cortex up here. And to have ALS diagnosis, as many of you know, you have to have problems in both your upper motor neuron up in the cortex and your lower motor neuron. So as much as we can fix the lower motor neuron, the patient recovery may not be that good because the upper motor neuron is still unable to fire that first impulse that goes down the spinal cord to signal the second one to flex the muscle. So we have to do something about this upper motor neuron as well as the lower. And we've known this for a long time. I'm very happy to say that through 3 years of work with another team, another neurosurgeon, Adam Mamalak, we've now been able to design a trial that this is this strange thing, guys, in your brain, where we think actually some of the ALS actually starts is in the upper motor neurons. And the motor cortex is remarkable in that your whole body is represented down this purple strip here. So in the inside of are your legs, and then it moves around. And because your hand is so important, it has a large representation in the motor cortex. In about this, it's called the hand knob around here. And then as you go down, the face is represented. So these neurons firing here will make your hand move, whereas neurons firing down here will make your face move, whereas neurons right here will make your legs move. So the idea of this trial is to inject stem cells secreting GNF into the hand region of the motor cortex to protect hand function, and we'll be testing patient hand function over time. And then if it looks encouraging, we can actually move forward and do both cells in this part of the spinal cord and in the motor cortex to slow down progression even further in patients. So I think to end, this is when you do these trials, as Bob was pointing out, it's a marathon and not a sprint, which means it's a building and building and building upon the foundation. I think what's interesting with CIRM is they've, the first 10 years, really built a huge foundation for the house. But I feel like to finish the house off, to put the roof on and to get it really beautiful and get it working, we now need the next 10 years of CIRM funding, which will allow us to build the house, move to different areas for us in the motor cortex in ALS, and really start testing more patients in these phase 2, phase 3 trials with CIRM funding that would allow us to do the second part. Drug development is a long, long, expensive process. You've heard stories of 10 to 15 years to develop a drug, and that's true from beginning of concept to final. And if you think that CIRM started around 10 years ago, they've got the very first part now of drug development, but now they need to do the large studies that are going to take these drugs through to many patients in California, and building on this is fantastic. So we're in the point now where we're going to be doing cortical injections. I did want to thank the entire team at CIRM for helping us get through this and fund this amazing study that is still ongoing. And these are the people at Cedars-Sinai who've been specifically involved. And I'll end on the fact that, well, the second, I have one slide after this, but also not to forget the 18 patients who participated in this trial. We knew this wasn't going to cure their disease. It was a way to test the first part of a long study. But the patients who entered it came in all knowing this, and many of them said, we just want to contribute. We know that if the cells can survive and you open this door of information, it'll continue to get better and the energy will go up, and there'll be eventually a stem cell treatment for ALS. So the patients were heroic. And of course, the next phase, and we always hope that we'll get a big result and we'll be able to move very quickly to further injections and further protection of these motor neurons for ALS. We've actually, this trial I've told you about is very specific for ALS, but through CIRM funding, we have another trial going on for Parkinson's disease. We have the similar model for Huntington's, for retinitis pigmentosa, stroke, and Alzheimer's. All of this foundational work is being used here, and CIRM is actually, of course, funding the ALS trial. We are kicking off, with any luck, very, very soon, within a month, trial for retinitis pigmentosa with the same cell product behind the eye, also CIRM funded. And finally, we're in the middle of preparing the cells now for another trial with Parkinson's disease with Chris Bankovich, also with CIRM funding. So the seed CIRM funding for the ALS trial has led to us to being able to use this product in other neurological diseases. And we're very hopeful that 14 will be funded so that that money that Bob mentioned for neurological diseases can be used in some of these trials as well. So I'll end there, and I'll very happy to take questions. And I'd also like to thank along the way the ALS Association, because they provided some early funding for this work actually prior to CERN when I was in Wisconsin, that led to the very start of this study. And the transition here with Fred and the Golden West chapter and all the people at the Golden West chapter has been, for me, fantastic. And their support of our clinic is crucial to make this all happen. And without that support and the integration with CERN, we wouldn't have been able to do the study either. So I'll stop there and take questions.
Thanks, Clive. That was fantastic.
Thank you so much, Dr. Svendsen. Thank you to Bob Klein. To Bob, if you would like to turn on your camera and your sound, I'll have a couple of questions that probably apply mostly for you. I will actually start out with a question we received ahead of time for Dr. Svendsen. If I hear or read about an interesting stem cell trial, how do I get enrolled? And what if this trial is not offered in the ALS center that I go to?
So you're absolutely right. You go to the center that you currently are a patient at and ask your neurologist, ask the people in the center, you know, how do I enroll in this trial? And it's either going to be, yes, it's a local trial. For our trial, we did keep it local. And many times with these smaller ALS trials, they keep them local because you want to see the patient every 3 months. And so you don't want it's very difficult to travel, particularly later in the disease. So many of them are local, but some of them are national. And so they may say, well, you know what, we don't have a site here, but there's one here you can enroll in with a multi-site trial. So just go ask your neurologist is the best way.
Perfect, thank you.
I mean, Fred, maybe the ALS Association has something on your website for trials as well.
Yeah, I think certainly if you're connected to the Golden West chapter or your local chapter, we at the Golden West chapter refer people to clinical trials all the time that they're either interested in or think they may be eligible for. So definitely talking to your doctor about it's important, but if you have questions, you can always bring that to us and we will connect you to the right people at those trial sites to determine your eligibility and the feasibility of your participating.
Terrific, thank you both. Question for Bob. Someone says, I read that Prop 14 will give a portion of the $5 billion to the UCs for research. Is this true?
So all of the grants are merit-based. And when I became chairman, we immediately convened a meeting with the National Academy of Science and the Institute of Medicine. And we set up a protocol where all of the scoring for grant applications is done by scientists from out of state who come to California. They meet, they do an expert review, they score each grant, and the grant goes to the governing board. So the UCs have to compete with everyone else, with the Cedars, the City of Hope, but they have been very successful. And the UC campuses at UCLA, UC San Francisco, UC Irvine, UC San Diego have been dynamic centers of research and clinical trials and have really moved a number of therapies way forward, including, for example, specifically that young girl was born without an immune system, Evangelina, who was treated at UCLA, for example.
Great, thank you. And what would you say are what's the percentage chance of 14 passing, and what should we do to help?
Well, we need 50% plus one vote. So any one of you could be the one vote, but it is critical that through your network, you get to the friends and families and make sure they get the information. We've sent, and Fred has lots of information in detail about the initiative. And it's critical that we rebut the false information being spread about the initiative. One of the fundamental claims by the opposition is it's unnecessary because there's plenty of NIH funding You don't need this funding. Well, Clive's grant wouldn't have been considered at the NIH because they don't fund pluripotent stem cell therapies because of religious pressure on the federal government. It is vital to understand that half of all government funding for stem cell research and clinical trials in California is from CIRM, the California Institute of Regenerative Medicine, which is the funding agency that distributes the funds through competitive grants that come from these bonds. So it is absolutely essential to maintain the advancements we're talking about tonight to get this additional funding.
Terrific. And we have someone who is asking for some talking points. She says, with voting ballots just arriving today, it's critical that we contact our friends and relatives to request their support for a yes vote on Prop 14. Can you send us some talking points so we can contact them and address their questions factually?
Sure. So I think, Fred, you have a whole set of talking points. And the ALS chapter that Fred leads is really on the cutting edge of the information about Prop 14. And if you send your comments into the Golden West chapter, they will send out information, they'll answer questions, they'll give you a great deal of backup, anything that you need to answer. And if there's some specialized question, Fred can get to doctors and scientists like Clive Svendsen, or get to us. We're going to make sure we get you the information.
That information, if it isn't already up on our website, certainly will be.
Great.
Great. Yeah, go ahead, Bob.
I just want to say thank you, because the individual efforts in amplifying these messages and getting out true information about Prop 14 and its predecessor, Prop 71, and that funding is vital here. The 90 patient advocacy groups and the medical societies that are in this, that are sponsoring this, are not big profit organizations. They're committed to patients and the advancement of science. So we can't afford the $100 million ad budget. Our ad budget is 1/10 of that. And we're dependent upon each of you to reach out to your friends and family and their friends and family to really spread the information about how critical this is.
And I'm told there is an article on the Golden West chapter website now. It's on our homepage. There's a big Prop 14 graphic, so you can't miss it. So we'll make sure everybody gets the information that they need. One other question just came in asking about slow progression ALS. It says, how do we get into a trial?
Well, it's a very interesting question. And what's happened with, so there's a number of trials going on now. There's an AMLEX trial that just closed, and 2 approved drugs, as you know, edavirone and riluzole. Edavirone and AMLEX, and in fact, the NurOwn stem cell trial, all require fast progressing patients. And, you know, I think what they're finding is that the companies, that these fast progressing patients are a lot easier to follow over time because they're pretty linear and they go down very, very, you know exactly, you can project how fast they're going to go and how severe the disease will be. Mm-hmm. In the slower progressing patients, it can be very wavy. So it can take a long time, which is good for the patient, but makes it difficult for drug companies to assess if their drug's working, because if it takes 6 years, it's a long process to get approval. So between, you know, having to be sort of a little bit practical about getting approval for these drugs and understanding if they work, many inclusion criteria to get into the trial. One of the major ones is fast progression. Now, once a drug is approved for fast progressors, like edavirone, the FDA will often allow it to be used in all patients. That doesn't always happen, but that's the labeling of the drug. And that's what one hopes is you get proof of concept with this fast progressing group, but then it can be expanded to slow progressors as well once it becomes an approved drug. And you have to, of course, get through the phase 1 and phase 2 and often phase 3, not always, because sometimes the FDA will say it's so powerful you can go straight to an approved drug. So that's a long answer, but that's kind of why. And it's tough on the patients. It's really tough if you're a slow progressor, because you want to be in these trials, right? And some of them don't allow you to enter because they're just after the fast progressors. Our trial is actually all comers for stem cells because we're We're using the other side, we're putting the cells on one side, so we don't mind how fast the patient progresses because we'll see the difference because we've got one hand versus the other, and only one hand got the treatment. And if it slows down, we got authority from the FDA to go in and then transplant the other side to slow the other hand down. But we'll be learning a lot from these trials in both fast and slow. And not every trial is fast progressor either. There are many trials that take all comers as well.
Wonderful. It's a great answer. Thank you very much. I don't see any other questions in the queue. Just a last call. If anyone has a last minute question, just please type it into the Q&A function at the bottom of your screen. Any final thoughts from any of the three of you before I wrap up our webinar tonight?
I'd just like to say that the patients are really the heroes here. And we're all committed to respecting, admiring, dedicating our efforts to really the inspiring commitment by the patients. It's extraordinary in their partnerships with the scientists like Clive Svendsen. But without the patients' commitment and bravery, we wouldn't make the progress that has been so remarkable to show the incremental steps in the last few years. And I just like to end by my admiration for their commitment to reducing the future of suffering from ALS.
Couldn't say it better. Very, 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 very true. It's all about the patients, and we're all there for you and trying to do our best. And I think one of the frustrations was, we want to go fast and we want to have the miracle cure, but we also want to do it right. It's a little like the COVID vaccine, guys. Yes, we want the vaccine, but if it's going to kill hundreds of people because it's not safe, no, we don't. So I think all of medical research has this friction. And as Bob said, the main thing is the patients and they're heroes, and they're going through, we couldn't even imagine, but we are there to help, and we'll do it as safely and as quickly as we can. We're all dedicated to helping.
I think what we're seeing here is why it's so important that we're advancing the mission priorities of the chapter simultaneously. We're talking about a public policy issue, Proposition 14, its connection to the science and the urgent need of people living with ALS on that science. And it is the voice of people living with ALS, their family, their friends, who help advance the public policy that advances the availability of funding for the research that's going to provide treatments and cures. It's why the chapter's mission is public policy, advocacy, care services, and research, because we can't find treatments and cures without bringing all of those elements together. And there's really no better example of that than the conversation we've been having tonight. So I want to thank Clive and Bob for your work in this area, giving help and hope to people diagnosed with ALS. And to all of you watching, I hope you will go to our website, go to the Prop 14 website, look at the talking points, look at the opportunity to make a transformational difference in the lives of people living with these devastating diseases, and most importantly, vote.
Thank you so much, Fred. Thank you to Bob Klein. Thank you to Dr. Svendsen. Just as a final quick note, we had someone put into the chat some information about how to find ALS clinical trials through als.clinwiki.org. So just take a look at that in the chat too. We sincerely hope that you'll join us for one of our virtual Walk to Defeat ALS events coming really soon, actually starting this Saturday. We have several scheduled in the coming weeks, and it's fast, easy, and absolutely free to register. It's such a good opportunity to gather together as a community, even though we can't be together in person. And on November 10th, we'll be offering another webinar similar to the one tonight in some ways. It's another one in our Ask Me series that will be focused on caring for the caregiver during November's National Family Caregiver Support Month. Your generous support fuels absolutely everything we do, and everything we do advances the search for effective treatments and cures for ALS. If you'd like to support the Golden West chapter, please consider making a donation today at give.alsagoldenwest.org. And please watch for the short survey on tonight's presentation that you'll receive via email in order to help us plan for future educational programs like these. Thanks so much again, and have a great night.